Hi, this is Divya, Assistant Professor, Biomedical Engineering Department in SNS College of Technology. In this video, we are going to see about the continuation of the previous videos, which is detailedly explained about the mammogram, the types of mammogram, and the procedure, how the mammographic procedure takes place, and what are the limitations of the mammogram, and what the patient does and does, with the patient should do and should not do and should follow, what are the procedures to be undergone in the mammogram, and the difference between the mammogram and the ultrasound. And finally, here, what is the difference between mammogram and MRI? Okay, mammograms uses radiations. We know that MRI is a magnetic resonance imaging, which is mainly used for identifying cancer cells in all over the body. Okay, cancer cells or any tumors all over the body, which is highly highly accurate. Okay, in mammogram, which is used only for breast cancer. Mammograms uses radiations, which is of smaller amount. In MRI, breast MRI, there is no risk of radiation exposure because MRIs uses magnetic field to create images. Okay, since there is a minimum amount of radiation, a small amount of radiation in mammogram, in MRI there is no risk of radiations exposure because MRIs uses magnetic fields to create images. Okay, mammograms provides an images of entire breast and often identify lumps that cannot be felt or extremely seen. Okay, mammograms provides an images of entire breast and often identify lumps. Mammogram generally identifies the lumps in the breast that cannot be felt or extremely seen. Whether the patients can identify, if the patient cannot identify the lump by his naked eye, by using mammogram the lump can be identified easily. Okay, whereas in MRI are more effective in detecting breast cancer in patients with dense breasts and patients with breast implants. Okay, MRI, as I told you already, MRI is the best one to identify tumors or a breast all over the body, and MRIs are more effective in identifying breast cancers also. If the breast is dense and even if the breast is implanted. Okay, in these two cases, MRIs are very effective in identifying breast cancers, whereas in mammogram it is mainly used for identifying breast cancer, and it can identify lumps which cannot be identified, which cannot be felt or extremely seen. Okay, they are also useful if a mammogram has detected an unusual lesions. Mammogram can identify a small abnormalities or an abnormalities, when the breast seems to be unusual, that can be easily identified by the mammogram, whereas in MRI its ability is better to detect small breast lesions that are sometimes missed on the mammogram machine also. From this we can see that how accurate accurate the MRI is. Since the mammogram is mainly designed and used for breast cancer alone, the MRI have the ability to detect a very small breast lesions that are sometimes missed on the mammographic machine. Okay, while the mammographic procedure, the missed data can also be identified by the MRIs, that is magnetic resonance imaging scan. Okay, these are the difference of mammography and MRI. Thank you.